All right, I'm on my way to Dr. Lipkin's 4-hour drive from Boston to New York to see Dr. Lipkin, my orthodontist. I'm about to have breakfast. I'm going to have steak tips, grilled steak tips, and I want to show you how quickly you can burn out your masseters and get an amazing mewing session in just by eating steak or other tough foods. Steak being my favorite because steak is tough but not going to break your teeth out of hardness like some other tough foods might, like such as mastic gum will rip the fillings right out of your teeth or chip cusps of your teeth off if there's been any compromise in that area before, such as with a filling. So I love steak. And mewing is like exercise, right? And so some people struggle to establish a habit where they actually do it because it's work. You got to focus on it. You got to engage muscles. You got to break out of your comfort zone. Mewing during everyday activities that you're already doing is key because that's how you really bake mewing into your life. Okay, you're going to eat at least twice a day during those 2 meals, or 3 if that's what you do. During those meals, eat tough foods that are going to work your jaws anyway. Here's how you do it. You cut morsels if you're driving. Normally I wouldn't cut up my steak like this ahead of time. I would just eat it in its contiguous form. Sometimes I even just pick it up and bite into it without a fork and a knife. In this case, I've cut up my morsels into about this size. You put one on one side, one on the other, and then you chew and masticate until the food swallows itself. Don't even focus on swallowing. Just keep chewing, and what you'll find is that your teeth and your tongue will masticate the food into an almost liquefied form. That liquefied food will work its way to the back of your throat by itself. And then the food will, so to speak, swallow itself. And in the meantime, your masseters will burn out like a motherfucker. So, let's try it out. One on each side. All right, so those 2 morsels of steak swallowed themselves in about 4 different increments, and that took, I don't know how long that took. What was it? Half a minute, something like that. But toward the end of that, about 75% of the way through, man, I wanted to take a break because my masseters were just fatigued from the chewing. So let's jump right back into it. 2 more pieces, one on each side. Amazing. So delicious and so nourishing and such a wholesome workout for my jaws. All I'm doing is focusing on chewing. I'm not focusing on swallowing at all. The swallowing happens all by itself just by you masticating. All right? Horace Fletcher taught this, by the way. Horace Fletcher was an influencer in the early 20th century. He was famous for teaching people how to properly masticate their food and enlightening them as to all the tremendous health benefits that you get from properly masticating your food, specifically by reducing the burden on your digestive system from the stomach down, because you're pre-processing the fuel. You're refining the fuel so that it burns cleaner in your system. That's why we have teeth in the first place, isn't it? So let's use them. Let's do another bite. 2 pieces, one on each side. You know, the other really important thing about chewing your food thoroughly, besides getting a fantastic mewing workout for your muscles, it teaches you how to be a nasal breather. If you look at dirty mouth breathing kids, and Lord knows that I'm not insulting them, and I pity them because it's a long, dusty road to go down when you start mouth breathing as a child. But if you look at kids with droopy faces, constantly stuffed noses, the way they chew, they literally hold their breath while they're chewing or sipping from a drink. They'll stop and then they'll take gasps of air. And why do they do that? Because they're not able to nasal breathe while chewing. Their nose is just, from having not used it for their infancy, for whatever reasons, allergies, not being breastfed, nasal tissue obstruction, right? They become mouth breathers, and then if you don't use it, you lose it. They remain mouth breathers, and then they completely lose their ability to nasal breathe, whether it's a skill or whether it's an anatomical deficiency. The skill and the ability of nasal breathing is lost upon them. And so chewing, because our lips are sealed and our mouth is occupied, there's no space to suck in air. I mean, that's how you choke, by inhaling air, and it rips food particles down into your throat where they don't belong. And I could see someone choking by doing that. So fantastic opportunity to become a better nasal breather is to nasal breathe while chewing tough foods. Let's do another bite. You saw there, about 80% of the way through that morsel, I took a nice deep nasal breath, kept chewing the whole time, didn't open my mouth and subject it to all that shitty bacteria in the air. Driving down a highway, Lord knows the air that is being fed into my vehicle is far from pure. Put it through the nose where there's filters, right? Hairs, turbinates, right? Adenoids. Whoa, that hawk almost got hit. I hate seeing hawks get hit by cars. Seeing them dead on the side of the road breaks my heart. I love birds of prey. Speaking of which, did you know that Benjamin Franklin thought that the national bird of the United States should be the turkey and not the eagle? Because the eagle is essentially a scavenger. It's kind of a cowardly bird in reality. It feeds off of the dead that other things have killed or that have died naturally in the wild. The turkey is a much more noble bird. It's territorial. It's protective over its territory. It's a fighter. Interesting. We think of turkeys as these goofy gobblers, but actually, at least Ben Franklin thought they were quite a respectable specimen. Last two morsels in this container. So, the last thing I want to talk about in this video is how important it is to have a good bite. Occlusion. We all think in terms of expansion on JawHacks, but really we need to also be thinking in terms of occlusion, because a good, comfortable, functional bite is a cornerstone to health. And the post-expansion orthodontic phase of treatment is the most underrated aspect of treatment that patients get themselves into. All they care about is, how am I going to get expanded? How much am I going to get expanded? What nasal airway benefit am I going to get? No one asks, well, how am I going to ensure that the orthodontist over the next 18 months after my expander finishes expanding, am I going to get a good bite back? Especially after I ravage my mouth with, 5 to 10 millimeters of skeletal expansion, which just creates an orthodontic challenge, to say the least. And if there's an asymmetry or an overexpansion, it creates an orthodontic nightmare, by the way. So patients need to be asking themselves, how am I going to get a good bite so that I can chew my damn food after I blow up this nuclear bomb in my mouth? And that's why, bringing this whole video full circle, I'm on my way to see Dr. Lipkin, and that dude has hooked me up with such a functional smile and bite. I mean, you see me ripping through this steak. Going on to my second container now. This bite's for Dr. Lipkin. Super fatigued. But do you think I could chew down on that beef if my TMJs were unhealthy? If when I bit down it cranked on one of my joints so that I had pain or clicking? Absolutely not. A good bite enables you to properly masticate your food, which in turn enables you to be a better nasal breather, to digest your food better, to develop your facial muscles and therefore your facial structure. It's all an interconnected health system, and every piece of it is essential. Your airway needs to be sized well enough for you to be able to breathe while you chew, okay? And my massive MSE expansion is definitely playing a huge part in my ability to masticate big morsels of steak, right? Because I've got so much oral volume. Thanks to Dr. Zubad Nuaz for that. He's the one who expanded me. But size is not everything. Coordination of the bite is critical if you want to do heavy lifting, so to speak, by chewing tough food. You can't lift heavy with bad form. So, thanks to Dr. Lipkin for the last 2 years of orthodontics, getting my bite into such a beautifully smooth functioning, frictionless, up-down motion and connection and coordination between the upper and lower jaw. All right, I'm going to keep going and driving my ass down to New Jersey to see Dr. Lipkin. Little mushroom, piece of steak. Let's go. Peace out.